Hey, I'm Di McQueen, licensed clinical social worker, family and addiction expert. I'm here with Dr. Brian Jackson, my longtime cohort who specializes in the field of addiction. Welcome to Healing Families Shattered by Addiction.
Di and I have worked with addicts, alcoholics, and their families for over 30 years combined. Our podcast and coaching programs focus on families who have a loved one suffering from addiction. Our experience has been that this disease affects families as much, if not more, than the addict or alcoholic.
Is your world spinning out of control? Are you codependent? Are you experiencing worry, loss of sleep, and difficulty concentrating? If so, you're in the right place. Brian and I have both personally lived it, learned it, and now we're going to teach you tools and techniques on how to get your life back that you thought was shattered by addiction.
Okay, let's dive in.
Brian and I are so excited to introduce to you our new sponsor, Lakeview Health. They are a wonderful residential treatment center. Whether it's the family member who is looking for a place or the addict or alcoholic themselves, this would be the place that we would refer them to. Brian, you have many years of experience with Lakeview.
Yeah, Lakeview Health is a center of excellent addiction treatment. They take an evidence-based approach, medical approach to treating this complex brain disease. They hold the Joint Commission's Golden Seal, and they were voted one of America's best treatment centers by Newsweek magazine. They deliver dual diagnosis, gender-responsive, and trauma-informed care at their gorgeous facility here in Jacksonville, Florida. But they do see people from all over the world do come here to Jacksonville to go to treatment at Lakeview. Their levels of care include medically supervised detox, which a lot of people do need. Then they stabilize them in a residential rehabilitation and partial hospitalization program. They have board-certified physicians, master-level therapists, and they work to address the unique needs of each patient. So in other words, it's not a cookie-cutter program. They help individuals build skills for long-term sobriety. So if you or someone you know needs treatment, please visit their site at lakeviewhealth.com. We also have a hyperlink on our website at familyandaddictionexperts.com where you can just click and get some information about Lakeview Health. And Di, I think you have a number for people to call if they would like to inquire about treatment.
I sure do. That number is 888-480-3799. That's 888-480-3799. Give them a call.
Hi, everybody. Welcome back to Healing Families Shattered by Addiction. I'm Dr. Brian Jackson. I'm here with my partner, Miss Di McQueen, and we're happy that you're tuning in today because we wanted to talk about something that's coming up for all of us, which is the holidays. And sometimes holidays can be a very, very difficult time for families if you have a family member that's active in their addiction. So we just want to go through that a little bit with you in terms of maybe some suggestions and tools and techniques that you might be able to use that can help you get through the holidays without being so sad, about the whole situation, and that maybe for the holidays you'll be able to put that situation on a shelf and be able to enjoy the holiday and your families, and you deserve it. So Di, you want to talk a little bit about some of the challenges that family members might have on a holiday? So we have Christmas coming up. We have New Year's coming up. We have Hanukkah coming up. So all kinds of holidays, all kinds of family get-togethers. You're seeing friends and relatives, maybe relatives you haven't seen in a long time, and you're trying to figure out, okay, what do I do with the family member that's active in their addiction? Do I invite them to the festivities? Do I not invite them? Flashbacks of maybe what it's been like at past holidays and the feelings that you had. And it's a difficult time to make those decisions. But again, it's just so important that, you recognize that you're entitled to celebrate the holidays and be happy in spite of what's going on with your family member that's, again, active in their addiction.
Absolutely. So I think the best place to start, B, is, as we were sort of talking about a little bit earlier, today that, my own personal experience from how difficult it was to go into the holidays knowing that we could have a wild surprise, right? And at the time, not really understanding enough to, the anxiety behind that just starts like way before the actual day occurs, and how we're going to proact to this situation, if we're going to proact to the situation. And for sure, in the beginning, before I knew any tools and techniques, I was reacting to the situation, so there was no proaction whatsoever. It was just everything was chaotic. Family members are all, going crazy, and usually it didn't end well. Let's just put it that way. People, so living with an active addict, was really difficult. And, so it wasn't just him. Then we had, a couple of alcoholics in the family, and everybody was coming. And usually there was World War III that occurred, because everyone was telling everyone how they're supposed to be acting. And pretty soon everything went haywire. Right. But what I can remember about most of that was that the feelings, preparing myself for that, and not having any kind of understanding that maybe setting a boundary might have been a good idea, beforehand, maybe having a discussion with other family members to ask how we were going to deal with this situation. If people came in and they were not acting appropriately or causing chaos within the family, how we might together as a united front sort of deal with that situation. Even the question of something like, do we want them to come? Nobody really thinks that like that's an option. That is an option. If it's going to save the, everybody's psyche, and everybody says, well, every single time this person comes to a family event, especially around the holidays, something really bad happens, and, they're acting inappropriate. Maybe their language is inappropriate. Maybe they are falling down. Maybe they're swearing, maybe they're threatening, whatever the case may be. That is always an option, right? Which is to say, the idea, we've had a discussion, and this year we're just not going to invite them. And that is okay, even though it's really sad. And I think that's where part of it, that comes up for families is the sadness behind all of that, which is not having the whole family together. And the guilt and shame that goes with that. Like this poor thing, they can't really help it. Even though they drive everybody crazy, or their behavior is so inappropriate, falling asleep at the table, eating like they haven't eaten a meal in 6 years, those types of things where you're going, oh my God, what do we do with this? And those are things that I never even knew was an option. Like that you could make choices beforehand and ideas of how we were going to do this, before the actual holiday began. That's just the beginning, where we began with those things, but we had to change some of those rules and regulations as time went on.
Yeah, and that's a great point, Di, or great points. So it's like you have 1 foot in, 1 foot out. Should we invite them? Should we not invite them? And what we want to avoid is the main event should be a joyous time. And let's just pick Christmas, a Christmas holiday where family are together. What we don't want the main event to be everybody walking around on eggshells because the person that's active in their addiction is acting out, and everybody's distracted by that. So, as sad as it is, sometimes it will reinforce for the person who is suffering from addiction. It might go through their head like, oh, I didn't show up for Thanksgiving. Well, I guess I didn't show up because I was using, or I wasn't invited. Oh, I wasn't invited, as a direct correlation to my alcohol or drug use. And sometimes that can trigger like, oh my goodness, this alcohol and drugs are causing me to not be with my family, to not be able to celebrate the holidays. And at that point, they might wake up, because they're the ones that have to wake up and say, you know what, I need to do something different. I need to seek some treatment. So the 1 foot in, 1 foot out, I think the quicker you make that decision as to whether you're going to invite them and be prepared for everything that comes along with that,
Mm-hmm.
or make the decision, the earlier the better, that they're not going to be invited. Or if you aren't going to invite them, you let them know that if they seem impaired, that they cannot come to the function. So the anxiety that goes with, should we invite them? Should we not invite them? Once you make a decision and, hold your guns to that, I think that your anxiety level will come down. And Di talked about, being sad and feeling guilty. My recommendation and encouragement to you would be like having a vase and putting it up on the shelf, meaning the loved one with the addiction, and take it down when you need to. You're entitled to have a happy Christmas, a Merry Christmas, a Happy New Year, just like so many other people are. So in no way are we trying to shame the alcoholic and addict, but with what we do in terms of working with families and trying to help them navigate different things, this is a very, very important one. And the holidays bring up a lot of feelings and memories, but we want to make new memories. We want to make new memories, and we want to try and do something different than what we've been doing in the past. I mean, I hear it a lot, like people have the expectation, oh, maybe it'll be different this time. And it's not. And then we go on to the next holiday, and maybe it'll be different this time, and it's not. So, that's just a function and the nature of the beast of addiction and how it affects not only the person in active addiction, but the entire family. So, I don't know, Di, if you've got anything on that, or you want to talk about?
I absolutely, totally agree. And the other thing to remember is that we're not responsible for the behavior of others. And so that was always one of those big things for me, which is I'm going to be embarrassed and ashamed because of my loved one's actions with other family members that we don't see all the time, right? And so I take that responsibility on, that somehow this is a direct, scope into who I am versus I really have nothing to do with this, and they can take responsibility for themselves. And if they act out, it becomes theirs. And that was a huge relief for me to realize, like, I don't have to do this. I don't have to make excuses. If the group decision was that this person is invited and they're allowed to come, like you said, maybe the boundary is if you're impaired at the door, I'm sorry, you can't come in or whatever. But, if they enter the house and everybody is there and then they begin to act out, it is not my responsibility, like, to take on that their behavior has something to do with me. I may have to do something about the behavior and deal with that, but those are those situations. We know there's a guarantee that often and regularly, even in the rooms we hear it, right? The old kind of trifecta or the trilogy that Thanksgiving, Christmas, and New Year's are milestones for people to remember how awful they were, that someone did something to ruin that day for them. And what I've learned in my recovery is that nobody ruins a day for me unless I let them. And that's a huge one, I think. There's nothing wrong with making, I'm sorry that you're not invited to the day, but we would love to bring you over a plate of food. And you can do that afterwards. A lot of times they're very grateful for that, because sometimes they can't get out of that, get out of their own way anyway to make it over. And you wait and you wait and you wait. That's another thing. If you set a time for dinner to be served or what have you, stick to it. Stick to that time and make sure that you just follow through. And, there's options of ways that you can also include that person without necessarily having them come. Right? So
Yeah, it's hard too because you love them, right? So
absolutely.
I hate to table it this way, but let's say the neighbor down the street, Joe, who is an active alcoholic, you would know more than the man in the moon. Invite them to your Christmas dinner. And I know it's hard, but you almost have to put your family member in that category for that day, is that it would be nothing but disruptive. So, it's difficult. You love them, but you can't let the disease control your happiness in your life. And so many times as family members, we do let that happen because we love them.
Right. We call that detaching with love.
Right.
Detaching
Exactly.
with love, which is a very difficult thing to do. It is challenging, right? We all can detach easily with hate, because when you're pissed, it's easy to separate that, right? When you detach with like, which was a practice that I started to learn, and, you kind of do it part way. But when you can truly detach with love, is that you place this person that you love, as Bri just said, it has nothing to do with how you feel about that person. You're detaching from the behavior, and that you don't really appreciate or accept that the behavior they're doing is okay at this particular event, right? But it doesn't mean I don't love and care about the person. I can do both. And that's a hard concept to wrap your head around, but, talk to us about it. We'll help you figure that all out.
Yeah, and there's another situation too that Di and I were talking about before we got on the podcast, and kind of on a upbeat note, the family member that's in early recovery, that's now rejoining the family and is going to be there for Christmas, and now everything has to be a little bit different. I don't want to say that it's awkward, but there may be some changes that you may need to make. And Di, we talked about it. I mean, any specificity, like some of the things that we talked about that the family members need to be aware of for the person who is early in recovery and coming to this special occasion.
Right. So first of all, we're so excited because they are coming and they are in recovery, right? And so we as family members and loved ones really want to do almost anything we can to support them. So that's always, my first question was, what can I do to be supportive for you? What would be comfortable for you? And, what does that look like for you? And oftentimes things like, if I was an active alcoholic, can we do something different and not have alcohol there this year, is really, the first thing that I would come to is, we will not be drinking in your presence to be supportive of you. Right. So that may be something that the person says, no, I don't want anybody to change that for me. And that's a discussion point, right? Where we can decide amongst everybody, is that important to show that support for that person? You and I sort of favor, like, depending on how early the recovery is, that might be something really important to do. And we can do a non-alcoholic bubbly. There's lots of options that can be done to make everybody feel like they're having a cheer without necessarily doing that. But I always start with, what is it that you think you might need from us so that we can help support you in the best way possible? Maybe they have to leave for a meeting and they say, I'm just letting you know that, at 2:00 in the afternoon, I'm going to go ahead and leave for an hour and I'll be back. Okay. That might be an option, something like that. I always think that if you're an outsider coming into the family, right? Like, not necessarily an outsider of the family, but like, I'm the son and my wife and I are coming over to the parents' house for Christmas dinner. Then wife and I need to have a plan of action. If I start to get really uncomfortable, then, it's okay for us to have that discussion. Like, what's the plan? If I start to get all jiggity and I'm feeling like I need to leave, how do I accomplish that without offending everybody else who's at the party? Right? So those are discussion points. It's okay to decide, do we want to take one car? Do we want to take two cars? If I'm getting really uncomfortable, should I go ahead and take an Uber home? Letting the host know ahead of time that there may be that, possibility, depending on how new in my recovery it is. Those types of things that might be really supportive to that person, especially if you are one of the family members that is close knit to this particular person. I think that's really, really a big one, right? Would you agree?
Yeah. Yeah. And another, really important, point I think to get across is, it may be that your loved one was addicted to cocaine, or they were addicted to opioids, and, dovetailing on what Di said about the alcohol, as addicts, and I'm a recovering addict and alcoholic, we like to change the way we feel. So they may never have been a drinker. And so therefore I've had family members say to me, oh, can't you just have one drink? Well, no, So, with opioids and alcohol, the pathways to the brain are the same. So, I think the gift that the person that's in recovery is giving the family is that they're no longer attached to the behavior that I was talking about. And maybe the gift that you give to them in support of them is to not have any alcohol in the house. And we have a non-alcoholic Christmas. We have our loved one back. Let's have hugs and kisses. Let's not, make everything be romanticized and socialized around the alcohol. So again, a very important point is it doesn't matter what your loved one's drug of choice was. They really need to stay away. It's like switching chairs on the Titanic. It's not going to turn out well. So, I think sometimes we overlook that. But, just talking to Di before we got on here, it was like, oh my goodness, let's talk about that,
Huge, really, really important point that I think a lot of people don't understand or bypass. Another thing that really comes to, both of our minds when we were talking about this is, especially somebody in early recovery, it's kind of like the first time we've all been together, maybe it's the first Christmas or first New Year's that you've been sober. Everyone's really awkward. They're not sure what to do. The best advice we can give you on that is just be you, just be natural. Like the person already feels like they're, being stared at and like they're the spotlight of the day. And, then all of a sudden it's like, okay, how do we talk around this person? What should we do? And, the most important thing is that you just treat them like you would any other day or any other person in the room, because it's uncomfortable enough for them to walk in sober. And maybe it's been a long time since they've been sober. So, they're already uncomfortable in their own skin and not knowing exactly what to do and how to handle themselves. And so the best thing that we can advise when it comes to, how should we act around them? Normal, be yourself, act, as if you would any other day. You don't have to do any special, like, oh my God, let's not talk about this, or, let's make sure that he's okay. And we ask him 84 times, are you okay? Do you need anything? Are you okay? Guaranteed it will make the person feel very, very uncomfortable. And it'll be awkward for everybody. So the first couple of minutes may be a little awkward because people are really trying to figure out what to do, and then just settle into it. Just settle into it and just be yourselves. That would be probably the best advice that we could give to you on that one.
All right.
Any other thoughts?
No, I think we really have touched on some of the key issues. Make a decision early on in the process as to whether the person's going to be invited or not. If you have a person in early recovery coming to the party, I think that's great advice. Just try and be natural because, here's the person kind of stark raving sober, feeling like all eyes are on them. So we want to try and make them feel as comfortable as possible. And again, that's a new dance for you, but it's a new dance for them too. And Di said this, it's a whole series of firsts. So think about it for them. First birthday without drinking or drugging. First Christmas without drinking or drugging, first New Year's without drinking or drugging. So the brain is kind of hardwired. So if it's a pleasant experience for them for this first, then, it will give them a great sense, of relief. So, but with that, Di and I wish you all the happiest of holidays. We, would be happy to field any questions that you might have as the holidays come up. You can send us an email at info@familyandaddictionexperts.com. That's info@familyandaddictionexperts.com. We have a website that's got family resources on there that you can download and print in PDF form. And that's on our website, which is www.familyandaddictionexperts.com. That's www.familyandaddictionexperts.com. We're also on Instagram and Facebook. And so now we're all grown up and on social media. So,
yeah, it is kind of funny, isn't it, B? We're like, oh my God. Yeah. Hey, one last thing. I want you to have a wonderful holiday, but do me a favor, folks out there. If your person's in new recovery, don't remind them how they ruined last year's holidays.
Yeah.
Please, it's like,
No
okay,
grenades. No grenades from the past.
no
No grenades.
grenades from the folks in the fam, okay? Family members are supposed to be there to help support. And at that point, if we're going to ask them, we don't need to rub their nose in it. Get it?
Yeah.
All right.
Never let go of hope.
Exactly. There's so much hope, and there's nothing more wonderful than to see someone in their first holiday past, getting sober. It's a beautiful thing.
All right. Well, thank you, Di. It's always good to be with you.
You too, Bri. Happy holidays. Thanks so much for joining our podcast, Healing Families Shattered by Addiction. We'll be back in a couple of weeks with more important tools, techniques, and ways for you to focus on you instead of the alcoholic or addict in your world.
Until then, please go to our website, familyandaddictionexperts.com. That's familyandaddictionexperts.com. You'll also see links to our Facebook and Instagram pages. Please also, if you have any emails that you would like to send us, that's info@familyandaddictionexperts.com. That's info@familyandaddictionexperts.com. With any thoughts, feelings, questions that you may have for us, we would love to hear from you, and we look forward to seeing you in a couple of weeks.